Hello friends, welcome back to our channel Longani Clinics. Today we are going to discuss one of the most popular and practical clinical repertory in homeopathy, the Boericke's repertory. Whenever homeopathic practitioners need a quick bedside reference, especially in acute cases, Boericke repertory often becomes the repertory of choice. This repertory was compiled by Dr. Oscar E. Boericke, while the famous Materia Medica associated with the Boericke name was written by Dr. William Boericke. Because both authors share the same surname, students often become confused. However, it is important to remember that the repertory was compiled by Dr. Oscar Boericke and is largely based on the clinical information available in William Boericke's Materia Medica. Boericke's repertory is classified as a clinical repertory. Clinical repertories are designed to help physicians select the remedies based on clinical conditions, pathology, causation, modalities, and concomitant symptoms. They become especially useful when the characteristic mentals and physical generals of the patient are not clearly available. The repertory underwent several revisions and improvements over the time. The repertory section was not present in the first edition and was introduced from the third edition onwards. Later editions incorporated a large amount of additional clinical material, making the work more comprehensive and practical. One of the unique features of Boericke's repertory is its simple grading system. Remedies printed in italics presents more frequent verified clinical remedies and carry greater importance, while remedies printed in Roman type are given lesser value. This makes remedy selection easier and faster in daily practice. The repertory contains more than 1400 remedies and is divided into two major sections, the repertory proper and the extensive index. The index greatly facilitates the search for rubrics and makes the repertory extremely user-friendly. Although Boericke's repertory is called a clinical repertory, it contains not only clinical conditions but also many subjective symptoms. You will find rubrics related to appetite, cravings, aversions, emotions, and the mental state. Because of this, it bridges the gap between purely clinical and symptom-based repertories. The repertory follows the Hahnemannian schema and consists of 25 chapters beginning with mind and ending with modalities. The largest chapter is the female sexual system, while the smallest chapter is gums. Headings, subheadings are arranged alphabetically, making navigation simple and quick. Another interesting feature is the arrangement of rubrics. For example, under a complaint like headache, Boericke systematically presents causes, types, locations, character of pain, concomitant symptoms, aggravations, and then ameliorations. This organized approach helps the physician analyze a case rapidly and accurately. Cross-references are also provided throughout the repertory, helping the practitioner move from one related rubric to another. Clinical names of the diseases are frequently mentioned in brackets, making the repertory especially useful for students as well as beginners. When it comes to the clinical applicability, Boericke's repertory is extremely versatile. It is useful in one-sided diseases, cases lacking generals, bedside prescribing, acute conditions, pathological prescribing, prophylactic prescribing, and even cases involving drug toxicity. These practical applications have made it one of the most frequently used clinical repertories worldwide. The repertory also contains many rare and interesting clinical rubrics. Rubrics related to prophylaxis, toxic effects of drugs, Addison's disease, acromegaly, bubonic plague, keloids, prostate enlargement, biliary calculi, fibroids, lipomas, and many other pathological conditions can be found throughout the work. Of course, no repertory is perfect. Since Boericke is primarily a clinical repertory, it cannot replace large and exhaustive repertories such as Kent or synthesis. Some rubrics are not ideally placed. Alphabetical arrangement is occasionally inconsistent, and certain printing errors may create confusion during the rubric search. Despite these limitations, Boericke's repertory remains a valuable companion for every homeopathic practitioner. Its concise format, clinical orientation, easy indexing, and practical approach makes it an excellent repertory for bedside use and rapid prescribing. In conclusion, Boericke's repertory successfully combines clinical practicability with homeopathic philosophy. Whether you are a student beginning your repertory studies or an experienced practitioner looking for a quick clinical guidance, this repertory continues to be an indispensable tool in homeopathic practice. Thank you for watching it. If you found this video helpful, please like, share and subscribe for more videos on homeopathic repertories and Materia Medica. Thank you.